Dr. Isaac Bogoch is an infectious disease specialist and a member of Ontario's COVID-19 task force. He joins me again today. Dr. Bogoch, good to see you again. Thanks for taking time, as always. Let's begin with the heartbreaking death of this 13-year-old girl in Brampton, Emily Viegas, one of the youngest COVID-19 deaths now in the country, one of the 8 Canadians under the age of 19 to have succumbed to this virus, and quickly it seems. Younger Canadians are now dying at home before they even make it to the hospital. Why is that happening?
Well, first of all, this is just an awful case. It's tragic, and I've read a few different articles sort of outlining the events, and it's just horrific. There's no other way to put it. Certainly we know that the variants of concern can cause more significant illness. We know they spread more quickly. That's probably driving some of it. I think it's also fair to say that as awful as this case is, and as awful as all the deaths are, the risk factors for death are still on the older end of the spectrum. They still are, even with the variants of concern. Yes, we are seeing younger and younger people land in hospital, but if we look at the risk factors for hospitalization and death, we still see, by far more older and the people on the older end of the spectrum who are significantly impacted. Doesn't mean bad things can happen to young people. They certainly do, and this is just a tragic example of it. But when we're looking at death and other negative impacts, it's overwhelmingly in people over the age of 40.
You are part of Ontario's vaccine task force. There are growing calls now to refocus the vaccinations on essential workers and those hotspot neighborhoods where most of the infection and spread is happening. So far, only about 25% of the vaccines going to those places. But there is talk of expanding and ramping up those doses to those communities. What are your thoughts on that?
I mean, when we were putting together the vaccine rollout plans, the stage 1, stage 2, and stage 3 rollout plans for the province, this is explicitly outlined in the second phase, which we're in right now. I mean, it says it right there that there will be priority vaccination for heavily impacted neighborhoods, including racialized neighborhoods and low-income neighborhoods. It's right there in the framework. So we certainly can work within the framework. And really the debate now is, to what extent, right? How much vaccine? Of all the vaccine we're getting, what proportion of vaccine should go into those neighborhoods? I think there's room to increase that. I really do. And I think it's the right thing to do because we know that about 50% of the infections are in 20% of the neighborhoods. So it's the right thing to do. It's the moral thing to do. It also ends this pandemic faster for everyone. I mean, if we quell that, right, it has tremendous spillover effects for the rest of the province.
There's also talk about reallocating. I mean, right now the vaccine is distributed on a sort of per capita basis, province to province, but some provinces are doing better than other provinces. Where are you on the notion that maybe we should start redistributing the vaccine, more vaccine going? Skip the per capita model. Let's send more vaccine to places that need it most.
I mean, listen, there's obviously the science and the public health, and then, of course, there's the politics. And I mean, this would be a very, very challenging conversation to have. Having said that, if you pour the water on where the fire is burning hottest, you're probably going to get the most bang for your buck. But I don't know how you would navigate that on a federal level. There'd be a lot of angry constituents, I think.
Starting this week and for the next 5 weeks, Canada will be receiving at least 2 million doses of vaccine a week. What impact will that volume of vaccine have on curbing the spread?
This is fantastic. So Pfizer is really stepping up, and we're actually doubling the amount of Pfizer that's coming into the country. I mean, it's incredible. It's a great vaccine. It's been able to be distributed very quickly through mass vaccine sites and through other venues. And I really think that the provinces can expand and they can really, continue to vaccinate at a fast pace, but ramp this even up further to just get as many people vaccinated in a shorter period of time. It will take some effort, but hopefully the infrastructure is there to do it.
Canada also begins receiving Johnson & Johnson vaccine this week, the single-dose vaccine, just as supplies of AstraZeneca are drying up for a bit. There have been concerns raised in the U.S. about the J&J vaccine and rare blood clots there. We may be facing some more hesitancy in this country around that vaccine in Canada. What concerns, if any, do you have about the J&J vaccine?
Supply is interesting. Like, we're going to get an initial shipment, but I'm really curious to see how much more we actually get in. And this is a great vaccine. Like, this is a one and done type vaccine. You don't require that same -20 or -80 cold storage that you do for Moderna or Pfizer. Like, this would be a great vaccine to really get in, in populations that just have barriers through no fault of their own, but in populations that have barriers to vaccination. So, shelter populations, prison populations, migrant farm workers. There's just a lot of really good groups that could have, equitable vaccine access with this when we can't entirely guarantee that we can get them back for a second dose. Obviously, we have to work to reduce those barriers as much as possible, but we also have to be mindful that there are, sad inequities that are going to take time to iron out. And I really think we can do a lot of good with this vaccine in those populations.
There are increasing calls for more testing of essential workers at the border and even tighter border controls as we see stories of Canadians exploiting a loophole in the flight quarantine rules by jumping in a taxi in the U.S. and taking it across the border. Are we doing enough at the border?
I think the border measures are doing something. Really, they are buffering us. It's not perfect. It's not 100%, but I think it's fair to say that we have buffered ourselves from a lot of COVID-19, including variants from coming into the country with the border measures. But no, it's far from perfect. Listen, we imported B117. That's the variant of concern that was initially discovered in the United Kingdom. We were initially able to count that on one hand, and now it's the dominant strain in many parts of the country. So we are importing it. Even if we import it infrequently, it can still have negative repercussions on the country. I think we also have to factor in any border measurement with an understanding that we are vaccinating and cases are actually starting to come down, plateau and come down. There's always room to tighten things up at the border, though, and there's always room to eliminate those loopholes. And certainly something that the federal government should be looking at.
I'm sure let's finish on this. I'm sure your perspective has changed from week to week as we go through the pandemic in terms of where we are, what we're up against. Tell me what you think as we start this new week. As you look down the road a little bit, what do you see?
Next couple of weeks are going to be tough. There's no question about it, right? Our healthcare system in many provinces is stretched beyond capacity, and it's just going to be a tough few weeks in the hospitals. If you look at the midterm and long-term forecast, I think things look really good. We're vaccinating hundreds and hundreds of thousands of people per day in the country. We've crested in many parts of the country and maybe have even started to come down out of this third wave. Other places, not just yet. So I think the midterm and long-term forecasts look good, but it will certainly be a very challenging few weeks ahead to get through this third wave.
All right, Dr. Isaac Bogoch, thanks again for your time tonight. Appreciate it.
My pleasure.